Do you know of any specific psychedelic compounds that are showing particular promising research for addiction?
I really think it would be very important to start possibly the first trial in Italy by looking at ketamine. I think among all the psychedelic is the most researched one, is the one that has already an implication in clinical terms. So I think we should make an effort and look at ketamine as a next candidate for hopefully a clinical trial, Italian clinical trial, and to work more on the substance. As I said, is well researched. There is a lot of potential there, and that would be my choice.
Thank you. Yes, ketamine is very promising for both depression and for pain, so that would be a great...
Potentially addiction too, you know,
addiction,
so open that, you know, especially it's been studied with alcohol, but also open it up in the future to behavioral addiction. We are living in a society where there is an explosion of problematic related to the internet, digitalization, so new form of addiction, not necessarily related to a substance, like could be cocaine or alcohol or others, but they are behavioral addictions. So the mechanism is very similar, but they are based on repetitive compulsive behavior. So it'll be very interesting to see more research by looking at solutions for behavioral addiction, which are really expanding rapidly in our society, and we don't have a clear answer to that yet. So I can see a potential of possibly ketamine or other substances in this field.
Thank you. And what do you think the role of universities is in getting on the train of psychedelics for the students, for new students who want or have interest in doing research?
I only gave one lecture about psychedelic in one of my courses in clinical psychology, and I had a long queue for weeks of students who are very keen to learn more about psychedelic, be involved in training and research. But I realized that there are not many opportunities for them. So I think there is a huge potential for early career, of course, but also for established researchers, because anything that we want to do with psychedelics needs to be evidence-based. So research should be the plays a fundamental role, and also in the relationship with policymakers, we need to use the evidence emerging from our studies to inform policymakers to make it a change. You know, when we study substances like psychedelic in controlled clinical settings, we need to go through very rigorous protocols. So it's a safe setting, and I think it's fundamental to work with policymakers, use the evidence base to show the potential that these substances could have as an alternative treatment to people who are in pain, who are suffering, and they should allow us to use it in our studies because they are controlled and is a safe environment for the patients to do so. So yes, university play a very important role, and I think the students even a better role, because they are the future's generation. So we should be able to provide them with new opportunities for training and research, and that will be one of our priorities. And this is also the why we organize this event.
Thank you so much for your time.
Thank you. Thank you.